Welcome to this explainer. Let's just dive right in, shall we? Today, we're walking through a comprehensive step-by-step guide on how to navigate those crucial hours and days right after your kid gets a vaccination. We're going to break down exactly what you should be doing, and honestly, just as importantly, what you absolutely should not be doing to make sure your child is comfortable and safe.
Look, you know the exact feeling. Your child just got their shots, you finally get home, and suddenly every tiny little thing they do feels like a massive red flag. They're crying a bit more than usual, maybe they're pushing their food away, you touch their forehead, and yeah, they feel a little warm. They're fussy, they're sleeping terribly, and immediately your brain starts flashing neon lights with one big question. Is this normal? If you have ever felt that wave of total panic, trust me, you are absolutely not alone.
But before we get into the nitty-gritty step-by-step, we really need to ground ourselves with a simple fact. Vaccines can and often do cause temporary discomfort. But that discomfort is almost always far milder than the actual disease the vaccine is protecting them against. It's a highly favorable trade-off for long-term protection, right? Keep that perspective in your back pocket as we move forward.
So here's our quick roadmap for this explainer. We're covering the first 30 minutes, keeping the normal routine, food, fluids, and fevers, managing that injection site, and wrapping up with when it's actually time to call the doctor.
All right, part 1, the first 30 minutes. Stay for observation.
The very first, most crucial step happens right there at the clinic immediately after the shot. Whatever you do, don't just grab your stuff and sprint for the car. You need to stick around for about 15 to 30 minutes, depending on what your clinic advises. Why? Well, because while severe allergic reactions are incredibly rare, they can happen. And if they're going to happen, the most dangerous ones typically strike within the very first few minutes. So that simple, boring window of just sitting in the waiting room, that's your first line of defense.
Moving right along to part 2. Keep the normal routine, and let's debunk this whole post-vaccine lifestyle idea.
So probably the absolute biggest mistake parents make after a vaccination is getting home and deciding to change up the entire day. They cancel walks, they skip bath time, they bundle the kid up in 5 layers of clothes, they start forcing extra food, and they hand out medicine just in case. Guys, practically all of this is unnecessary, and it can actually make your kid more miserable. Your child doesn't need a special bubble-wrapped post-vaccine lifestyle. They just need their normal life. If they take a nap at 1 o'clock, put them down at 1 o'clock. Routine is incredibly comforting to a child who feels a little off.
And let's kill a very specific myth right now. The idea that you can't take your kid outside after a vaccine. Completely wrong. A walk outside in the fresh air is a great idea. Being outdoors actually reduces your exposure to respiratory bugs compared to being stuck inside. Now, on the flip side, dragging them through a super crowded indoor supermarket, yeah, not ideal. You want to avoid tight indoor spaces with a bunch of potentially sick people. Not because the vaccine somehow weakened your child's immune system, but because stacking a brand new viral infection on top of a highly active immune system is just totally unnecessary stress on their little body.
Oh, and what about baths? Bathing is 100% fine. A vaccine injection does not dissolve in water. Getting in the tub isn't going to wash away the vaccine's effectiveness or anything crazy like that. In fact, a nice, warm bath might be exactly what your fussy child needs to finally relax.
Okay, part 3. Food, fluids, and fevers. Let's talk about understanding your child's body. Now, it is super common for kids to lose their appetite for a bit after getting a shot. And naturally, parents panic and start trying to force feed them. Take a breath and don't do that. A kid who refuses food is usually just listening to their body, and healthy kids are actually remarkably good at self-regulating. So if they push the plate away, don't force it. When they're feeling this temporary discomfort, hydration matters so much more than food. Just focus on offering fluids, keep an eye on them, and let them bounce back on their own timeline.
Then, of course, we get to the scary part for a lot of parents, the temperature spike. Mild fevers are one of the most common reactions out there. But I want you to remember this because it's a huge takeaway. A fever means the immune system is working. The fever itself isn't the enemy here. It's actually a completely natural, healthy sign that their immune system has clocked the vaccine and is doing exactly what it's supposed to do. But because fever stresses out so much, parents are always asking, hey, should I just give them some Tylenol before the fever even starts? According to current pediatric guidelines, that is a definitive no. You should not be giving routine, preventative fever medication. Do not automatically give acetaminophen or ibuprofen before symptoms actually show up.
Instead of jumping the gun, just follow this approved game plan. Step 1, wait and see if a fever actually develops at all. Step 2, check if your child actually feels miserable. Some kids run a slight fever and act totally fine. Step 3, use an age-appropriate standard medicine like acetaminophen or ibuprofen only if it's genuinely needed for their comfort or if your doctor specifically told you to. And always, always double-check that you're using the right dose for their age and weight.
Moving on to Part 4, managing the injection site. Here's what's normal and what actually helps.
You are probably going to see some kind of local reaction on their arm or leg. It is incredibly common for the injection site to get red, sore, firm, or slightly swollen, especially if they just got a DTaP vaccine. The good news is that redness usually clears up within several days. But check this out. A small, firm lump under the skin might actually stick around for weeks or honestly, even a few months. That is still perfectly normal, so if you feel a little bump 3 weeks later, don't panic.
So what can you actually do to soothe the spot? The instructions are wonderfully simple. Do apply a cool, soft compress to take the edge off the discomfort. But please don't go hunting for internet miracle creams. Don't use alcohol compresses, and definitely do not rub the area aggressively. Time does most of the healing here, and a cool washcloth is pretty much the only intervention you need.
And finally, Part 5, when to call the doctor. Let's identify the actual red flags.
While observation is key, here is your definitive checklist for when to stop watching and start dialing. You need to call your pediatrician if a fever persists beyond a couple of days, if their symptoms are actively getting worse instead of better, or if your child becomes unusually lethargic, like they won't wake up to drink. You should also call if you notice any breathing changes, or if there's severe swelling. But honestly, the most important bullet point on this list? If something just feels clearly wrong, trust your gut. You know your kid better than anyone. We want calm observation, not blind panic. So if you see these red flags, just make the call.
So, to wrap up today's explainer, here is your post-vaccine mantra. Don't panic. Don't try weird internet home remedies. Don't blame every single sniffle on the shot. And please, don't turn your child's world upside down. Do something much simpler. Watch carefully, stay calm, keep your normal routines, offer plenty of fluids, and just be there to give them comfort. That is usually the whole shebang. It's all they need.
I'll leave you with this one final thought to chew on. The goal after vaccination isn't to do more. It's not to micromanage and interfere unnecessarily. The absolute smartest thing you can do for your kid is to simply let nature and their incredible immune system do its work. Kind of makes you wonder, right? How many other modern parenting anxieties could we solve by just taking a step back and trusting the body's natural processes? Thank you so much for joining me for this explainer, and I will see you next time.